Hello, everyone. This is Dr. Clark from the Center for Weight Loss Success and the Center for Hormone Health and Wellness. And yes, I do both of those, weight loss and hormone replacement, bioidentical hormone replacement. So yes, we have both corporations right here in Newport News. So I want to talk a little bit about how do those two things, so hormone replacement and weight loss, go together. It's very common that I'll have someone come in to see me for hormone replacement, and one of the first things out of their mouth is going to be, gee, I want hormone replacement because it'll help me lose weight. So, is that true? Is it going to help you lose weight? Well, the bottom line to that is it depends on what hormone we're talking about. I talk about testosterone very frequently. Testosterone is incredibly safe. And as we're going to talk about here, is that yes, it can help you with some weight loss. But the other hormones which people are typically coming in to see me for, both progesterone and estrogen. Estrogen typically is often used to treat the symptoms of night sweats and hot flashes, as well as vaginal dryness. Works wonderfully for that. Now, if you were postmenopausal and coming in and we were giving you estrogen, you would also need to take progesterone. And progesterone helps offset the stimulatory effect of the estrogen to your uterus. Now, if you don't have a uterus, that's not an issue. But if you do, then potentially taking progesterone. So how does progesterone affect weight? Well, the most common side effect of progesterone is weight gain. So typically progesterone isn't going to help you lose weight. And for that reason, we try to use the smallest dose possible if it is absolutely needed. And typically it's those women that are postmenopausal that are still have a uterus and are receiving estrogen. So we try to avoid the progesterone or use the smallest dose possible because it commonly works against weight loss. All right, what about estrogen then? And again, when we talk about estrogen, humans make three types of estrogen. Estradiol is the most important one and typically the one that we are going to replace. The other two, estriol is very important in pregnancy. Estrone, actually, we try to keep to a minimum estrone because estrone typically is a weight gain hormone. Estrone levels tend to go up postmenopausally. So estradiol, back to the one we may actually be replacing there. Estradiol typically is weight neutral. Okay? It generally doesn't cause weight gain, generally doesn't cause weight loss, except in really high levels. Estradiol can cause weight gain and actually be really fast weight gain. So estrogen, as I talk about frequently, is it's something we have to be careful with. We want to keep levels fairly reasonable, the levels that will fix night sweats, hot flashes, vaginal dryness. Okay? So I try to use the smallest dose of estrogen, estradiol, as possible to avoid that high levels that can potentially cause some side effects, weight gain being one of them. All right, well then about testosterone. Testosterone is an incredibly safe hormone. It's very important for men and women, and we get a lot of leeway with that. When I say a lot of leeway, there isn't a right and a wrong level. It's what level tends to help fix symptoms as well as not give you side effects, which the side effects of testosterone are, they're nuisance side effects. Breakout in acne, growing extra wild hairs. And that's just adjusting the dose somewhat. So testosterone very safe, but how does it affect weight loss? Typically, testosterone in the long run is going to help with weight loss. And part of that is in the long run. Now, when I say long run, we're talking about 6 months to a year and a half before it actually starts with helping with weight loss, due to the fact that it actually helps preserve lean body mass. If you're working out, you can build lean body mass. Subsequently, that boosts your metabolism up significantly. So yes, in the long run, it can help with weight loss. Well, what about in the short run? Maybe. The answer there is maybe. And the reason I say that testosterone by itself won't help with weight loss until you've actually done the work to help with weight loss. But testosterone does fix so many symptoms that tend to have negative effects on our life. From I don't sleep well, I have poor energy, sex drive, I'm not thinking clearly. Testosterone helps with a lot of those symptoms, such way that I feel so much better. It's a lot easier to do the right things with weight loss. So can hormone replacement help with weight loss? The answer really is not as simple as yes or no. Depends on the hormone and depends somewhat on the levels as well, and whether we're talking short term versus long term. Want to know more? Give us a yell here at the Center for Hormone Health and Wellness, as well as Center for Weight Loss Success. Phone number is exactly the same, 757-873-1880. Come visit us in the Kiln Creek area in Newport News at 711 Brick Kiln Boulevard in Newport News, Virginia. Talk to you soon. Take care and have a good day.